So the engagement that we're working on right now started a couple of months ago, and we are helping lead one of the Undersecretary for Health's top 5 priority initiatives, which is the Diffusion of Excellence initiative. And what this initiative is really about is about taking innovations from the field across the VA healthcare system, across 150 medical centers, over 800 community-based outpatient clinics, and identifying those best practices and innovations happening in the field that should be scaled nationally or could be diffused to a subset of other medical centers. So what our team is doing at Atlas is we're helping VA develop both the strategy for that broader implementation and to institutionalize a mechanism by which VA can systematically diffuse best practices, as well as implementing that strategy across VA. So over the next 8 months, what our team will be doing is we've helped VA identify 12 promising practices that we are going to be doing a facilitated diffusion to other medical centers and outpatient clinics. So we will be providing the project management support as well as the strategy and design support to help figure out how do we adapt those practices that worked very well in one medical center to meet the needs of the veteran population in another medical center facing a similar problem. So we'll help them figure out how to adapt those practices, and we'll manage or support the management of implementing those practices in 12 other facilities, and in some cases more than that, across the country. At the end of the initiative, we'll have done a facilitated diffusion at those medical centers, and we will have also hopefully seen some natural diffusion just by communicating what VA is doing, helping share those best practices across the system, and we'll have also helped VA establish and institutionalize a longer-term strategy and process for having that diffusion occur naturally. We had 28 medical center and VISN, which are networks or region directors within VA, sign up to be sharks in the Shark Tank. And those sharks bid on 20 promising practices who were finalists as part of this process. So the finalists had submitted a practice from a medical center that they worked at, something that they had done successfully and implemented to solve a challenge around access, care coordination, employee engagement, or quality and safety. And they pitched those practices in 2-minute pitches to these medical center and regional sharks. We received a lot of bids. Some of the practices had as many as 11 or 12 bids from these sharks. And one of the most exciting things was that after it was over and we, sent out an evaluation survey, those sharks told us from 100% of the sharks that they intended to implement the practices that they bid on, whether that practice was selected as part of the gold status competition that we were facilitating going forward. We are now seeing that in at least 28 medical centers across the country, several of these 20 promising practices will be diffused naturally.